Cryptosporidiosis is an waterborne disease, communicable disease. Look at this picture shows that disease transmission. A digestive system where protozoan genus parasites which cause the disease. A detail going on. Introduction. Cryptosporidiosis is a parasitic disease caused by the protozoan genus Cryptosporidium. It primarily affects the gastrointestinal tract and is recognized as one of the leading causes of waterborne diseases worldwide. This illness is particularly concerning for individuals with compromised immune system and in areas with poor sanitation. Etymology. The term cryptosporidiosis is derived from the Greek word cryptos, hidden, and spirosis, seed, referring to the small hidden nature of the parasites oocysts. It was first described in 1907 by Tyser, who identified the Cryptosporidium genus in the intestinal tissue of mic. A definition. Cryptosporidiosis is a diarrheal disease caused by Cryptosporidium parasites. The microscopic organisms infects the intestinal lining, leading to gastrointestinal symptoms, especially watery diarrhea. The infection spreads through contaminated water, food, or contact with infected individuals or animals. Types. 1. Intestinal cryptosporidiosis affects the intestines, causing diarrhea, abdominal cramps, and dehydration. 2. Pulmonary cryptosporidiosis, a rare form that affects the respiratory system, seen mainly in immunocompromised individuals. Causes. Cryptosporidiosis is caused by injection of Cryptosporidium oocysts. Common sources include 1. Contaminated water, lake, swimming pools, drinking water. 2. Infected food. 3. Contact with infected humans or animals. 4. Poor hygiene and sanitation. Transmission: 1. Waterborne transmission. 2. Foodborne transmission. 3. Person to person contact. 4. Animal to animal transmission. 5. Environmental exposure, soil or surface, poor sanitation. Risk factors: 1. Weak immune system, example HIV/AIDS, cancer, organ transplant recipients. 2. Young children and the elderly. 3. Living in or traveling to areas with poor water quality. 4. Occupational exposure, example farmers, veterinarians. 5. Use of public recreational water facilities. Complications: 1. Severe diarrhea. 2. Malnutrition, especially in children. 3. Chronic diarrhea in immunocompromised individuals. 4. Electrolyte imbalances. 5. Failure to thrive in pediatric populations. Pathophysiology: upon injection, Cryptosporidium oocyst release sporocytes that invade epithelial cells of the gastrointestinal tract. The parasites reproduce within the host cells, causing epithelial damage, inflammation, and increased intestinal permeability. This leads to water diarrhea, malabsorption, and fluid loss. Cryptosporidiosis is caused by protozoan parasites called Cryptosporidium, which primarily infects in the intestines of mammals, including humans. Here is step by step outline of its pathophysiology. 1. Injection of protozoa. 2. Oocyst activation. 3. Attachments and inversion. 4. Intracellular development. 5. Reproduction. 6. Cellular damage and inflammation. 7. Clinical manifestations. 8. Immune response. 9. Seeding of oocysts. Infected individuals seed millions of Cryptosporidium oocysts in their feces, which can contaminate water sources and perpetuate the cycle of infection. 10. Transmission. Transmission occurs through the injection of contaminated water or food or through direct contact with infected individuals or animals. Understanding these steps helps in both diagnosing and managing cryptosporidiosis, which is particularly important in healthcare setting and for public health interventions to prevent outbreaks. Signs and symptoms: 1. Profuse watery diarrhea. 2. Abdominal cramps. 3. Nausea and vomiting. 4. Low grade fever. 5. Fatigue and malaise. 6. Weight loss. Diagnosis: 1. Stool examination. Detection of oocysts using microscopy with special strains, example acid fast strains. 2. Polymerase chain reaction PCR for identifying Cryptosporidium DNA. 3. Enzyme linked immunosorbent assay ELISA to detect antigens in stool samples. 4. Biopsy in severe or unclear cases, intestinal biopsy may confirm infection. 5. Serological test rarely used but may aid in research setting. Nursing diagnosis: 1. Risk for dehydration related to excessive fluid loss. 2. Risk for electrolyte imbalance related to diarrhea. 3. Altered nutrition less than body requirements related to malabsorption. 3. Risk for infection transmission related to poor hygiene practices. 4. Fatigue related to prolonged illness. Management, medical management. 1. Rehydration therapy. ORS, oral rehydration salt. For mild cases, intravenous fluid for severe dehydration. 2. Antibiotic medications. Nitazoxanide is the drug of choice. Azithromycin may be used in immunocompromised patients. 3. Symptomatic management. Antidiarrheal agents for severe cases. Pain management with antispasmodics. Nursing management. 1. Monitor fluid and electrolyte balance. 3. Educate or proper hygiene to prevent spread. 3. Promote nutritional support to combat malnutrition. 4. Provide emotional support to reduce patient anxiety. 5. Implement infection control measures in healthcare settings. Treatment options: 1. Pharmacological. Nitazoxanide rehydration solution and supportive therapies. 2. Non-pharmacological. dietary modifications, example avoiding lactose, adequate hydration and rest, psychosocial medicine. 1. Educate patients and families about the disease, transmission and prevention. 2. Offer counseling to address anxiety and stress related to illness. 3. Facilitate support groups for patients with chronic or recurrent infections. 4. Advocate for community level interventions to improve water quality. 5. Promote community education programs about hygiene and sanitation. Prevention. 1. Practice proper hand washing, especially after using the toilet or handling animals. 2. Avoid drinking untreated water. 3. Wash fruits and vegetables thoroughly. 4. Maintain good hygiene in child care setting. 5. Use water filtration systems to remove Cryptosporidium oocyst. In conclusion, cryptosporidiosis is a significant public health concern, especially in vulnerable population. Early diagnosis, effective treatment, and preventive measures are crucial for managing this disease and reducing its impact. By improving sanitation, hygiene, and access to clean water, the global burden of cryptosporidiosis can be significantly reduced. Thank you. Have a nice day.